How's it going, guys? So another ophthalmology question for you. I will cut to the chase, just tell you exactly what you need to know for USMLE, okay? Not waste your fucking time here. So before we get started, please subscribe to my channel. I really appreciate it. Give the video a thumbs up, really appreciate it. And find me on Instagram at melman_medical, MEHL_medical. Link is down below. Find us on Telegram. Recently created a Telegram group and channel. Links are down below. Now starting the fucking question here, where we have a 59-year-old dude, 30-minute history of pain, sudden loss of vision in his left eye after being hit at the gym while boxing. 20-year history, type 2 diabetes mellitus. He's a heavy smoker. Hypertension managed with lisinopril. Blood pressure currently is 150/90. Fundoscopic examination is performed, shows this spot diagnosis here. Now, even if you don't know what you're looking at, okay, we'll walk through the answers here. So choice A, diabetic retinopathy, wrong fucking answer. Now look, you don't have to be an ophthalmologist. You can look at the fundoscopy and be like, look, I literally have no idea what I'm looking at here. I've seen a million images on Google. I just still wouldn't know what I'm looking at. It's okay. Just, I want you to verbally memorize some points. So diabetic retinopathy, you're going to see a mix of hemorrhages. We don't see hemorrhages here, do we? Okay, like even if you say, once again, I don't know what I'm looking at, just it doesn't appear that we have hemorrhages here, right? And you would also see lots of fuzzy white looking things. Those are known as cotton wool spots or soft exudates. That's axonoplasmic material. It's just from nerve damage. Once again, even if you say, I don't know what I'm looking at, it doesn't look like we see lots of white, fuzzy, cloud looking things here. Not really, right? Hard exudates as well, which would be proteinaceous material, fibrinogen, albumin leaking out of vessels. It's, once again, hard to know what we're really looking at, but we don't see lots of yellow accumulations here. We don't see that stuff. So we just keep looking at our other answer choices. Hypertensive retinopathy, also wrong fucking answer. We would see what are called flame hemorrhages, okay? And retinal narrowing and AV nicking. I want you to just memorize that verbally. USMLE is not going to show you a fundoscopy of hypertensive retinopathy, and then you have to be like, oh yeah, obviously that's AV nicking. You don't have to know that. Like, they'll just verbally tell you in a stem. They'll say there's arteriolar narrowing on fundoscopy, or there's AV nicking, or there's flame hemorrhages, and you just have to say, yeah, that's a hypertensive retinopathy. They can also say absence of venous pulsations, okay? That means increased intraocular pressure, but also part of hypertensive retinopathy. Our correct answer is retinal detachment. Now, you see the well-demarcated border here of the detached retina, okay? So this is a spot diagnosis. This is high yield, notably on 2CK, but it's fair game for step 1. It's just, you see what looks like a line, okay? This is well-demarcated. This upper part of the fundoscopic image here, this grayish area, this is the entire retina, the part of the retina that's detached, okay? So once again, spot diagnosis here. Now a distractor, of course, is vitreous hemorrhage. You say, oh, the guy was hit. That could be a vitreous hemorrhage. 2 points. 1, vitreous hemorrhage, the fundoscopy will literally be all red. Okay, if you were to Google image vitreous hemorrhage, it's just a red fundoscopy. It looks nothing like this. The second point is the most common cause of vitreous hemorrhage is diabetes. Now, whilst this guy does have diabetes, okay, I didn't make it an ultra easy question. I did give you significant risk factors. So you should be aware that diabetes is the major risk factor of vitreous hemorrhage. Oftentimes they won't say that and you can eliminate it right away, but the fundoscopic image is just not red. There's no hemorrhage here, okay? Which you'd be able to see. So this well-demarcated border, this is our retinal detachment, spot diagnosis for USMLE. They can describe it as a curtain coming down over the visual field when a patient has retinal detachment. You know the deal. I'm going to continue to make more content. If you like my stuff, subscribe to my channel. And I appreciate your time. That's it.